Hello, my name is Peter Lawrence, and I'm pleased to introduce the January issue of the Journal of Vascular Surgery, Venous and Lymphatic Disorders, and to highlight 4 outstanding papers which are freely available for the next 2 months. The CME article for this issue is Iliac Vein Stenting is Safe when Performed in an Office-Based Laboratory Setting by Satwa and co-authors. Between 2015 and 2019, 1,223 iliac vein wall stents were placed in 1,104 patients, with 24% men and 76% women. All patients received moderate sedation during the stenting procedure. 90 minor complications and 5 major complications, that is 7% and 0.4% respectively, occurred. Major complications included 1 allergic reaction, 1 atrial fibrillation, 1 supraventricular tachycardia, chest pain, and 1 acute stent occlusion. And all of these patients were admitted to the hospital. Minor complications were primarily related to insertion site hematomas and were managed without hospital admission. No complications were related to the sedation that was used or acute renal failure, and there were no mortalities. The authors concluded that major complications are rare after iliac vein stenting in an office-based setting, and that minor complications were related to the insertion site hematomas and did not require hospitalization. Our next article, titled A Randomized Controlled Trial to Evaluate the Safety and Efficacy of Transluminal Injection of Foam Sclerotherapy compared to ultrasound-guided foam sclerotherapy during endovenous catheter ablation in patients with varicose veins, is by Watanabe and co-authors from Japan. They compared the treatment of patients with both great saphenous vein incompetence and large tributary veins using either an endovenous laser ablation and concurrent 1% polydocanol foam sclerotherapy, which was placed through the access sheath, called transluminal injection of foam sclerotherapy, or TLFS, to those with endovenous laser ablation and concurrent direct puncture that was ultrasound guided with foam sclerotherapy directly into the branch or tributary veins. Both the combined TLFS and EVLA in 103 legs and the UGFS, or ultrasound guided foam sclerotherapy with EVLA in 94 legs demonstrated 100% saphenous vein occlusion. But the venous clinical severity score was significantly improved in the TLFS, or transluminal foam sclerotherapy group, compared with direct ultrasound-guided foam sclerotherapy, indicating more effective tributary treatment with transluminal foam. Multivariable analysis revealed that the TLFS was the only significant factor for improved venous clinical severity score, and that an additional second stage of sclerotherapy was avoided with the transluminal technique. The third article, by Schaefer and co-authors, is entitled The Clinical Significance of Ultra-High D-dimer Levels. Since plasma D-dimer levels greater than 5,000 are encountered in numerous conditions other than venous thromboembolism, and some have proposed plasma D-dimer levels as a prognostic indicator for COVID-19 infection, the authors studied the plasma D-dimer levels that were over 5,000 in hospitalized patients in a single institution before the COVID epidemic. Over 4 years, 671 patients had a D-dimer greater than 5,000. Venous thrombosis was the most common diagnosis, followed by cancer and pneumonia, and no cause for the high D-dimer could be identified in 11%. The mortality was 24% in those that had a 5 to 10,000 range of D-dimer. It was 29% in those with a 10,000 to 15,000 range, and 75% in those with more than 15,000 D-dimer. This study suggests that ultra-high plasma D-dimer levels indicate a severe underlying disease, even without COVID. This information should be considered when using D-dimer as a screening tool or a prognostic indicator for COVID-19 infection. The final article highlighted this month is the economic impact of infection requiring hospitalization on venous leg ulcers by Melikian and colleagues. They performed a retrospective study of 78 patients followed for a minimum of 12 months with CEP6 venous leg ulcers, or VLUs, treated by vascular surgeons. Patients who had an inpatient admission for infection were studied for medical resource utilization, defined as the number of clinic visits, visiting nurse visits, and inpatient admissions. 11.5% had at least one admission for infection related to the venous leg ulcer in 1 year, with 5 patients requiring recurrent admissions. The number of outpatient wound center visits and visiting nurse appointments was significantly greater for those with infections. The total cost for infections in this study was $27,408, which is almost threefold higher than those with non-infected venous ulcers, which cost $11,088. Subsequent nursing costs were also $9,956 for those with infection versus $4,657 for those without. The authors concluded that infections in venous leg ulcer patients led to an overall increase in medical resource utilization and overall cost of care. The venous leg ulcer patient with infection requires more frequent patient admissions, outpatient visits, and nursing services. Thanks for watching. For more information, please follow us on social media, and remember to like, comment, and share. We hope you enjoy these 4 highlighted papers and the other excellent papers in this month's Journal of the Vascular Surgery, Venous and Lymphatic Disorders. Remember that these articles are free to read until the end of February. And thank you for your attention.